The silent health risks people face after 70. Many people believe that the greatest health dangers announce themselves loudly: a sharp pain, a sudden collapse, a dramatic diagnosis. But for most older adults, the most dangerous threats arrive quietly. They do not come with alarms. They do not interrupt daily routines. They blend into normal life, often mistaken for simple aging, and that is what makes them so dangerous. After 70, the body becomes more vulnerable, not because it is weak, but because it adapts silently. Systems compensate, symptoms soften, warning signs fade into the background. What once would have caused discomfort now feels familiar. Doctors often say that the most serious health risks in later life are not the obvious ones. They are the silent risks that slowly build while everything appears fine. This is why many families are shocked when something suddenly goes wrong. There was no emergency, no complaint, no sign that anything serious was happening. In this video, we will explore the silent health risks people commonly face after 70. These are not rare conditions, they are patterns doctors see repeatedly. Understanding them can help you protect not only your health, but your independence and quality of life. The first silent health risk after 70 is gradual cardiovascular strain. Heart problems do not always announce themselves with chest pain. In older adults, the heart often struggles quietly. Blood vessels stiffen with age. Blood pressure becomes more variable. The heart muscle works harder to maintain circulation, especially during rest. Many people assume that feeling slightly more tired or slower is normal aging, but doctors warn that subtle fatigue, reduced stamina, or mild shortness of breath can be early signs of cardiovascular stress. Nighttime is especially risky. Blood pressure changes during sleep. Heart rhythms become more sensitive. Small disruptions that once would have been corrected easily can now persist longer. Doctors often find that people who experienced sudden nighttime cardiac events had weeks or months of subtle symptoms that were ignored. The danger is not sudden effort, it is long-term, unnoticed strain. Regular monitoring, gentle daily movement, and managing stress help reduce this silent risk. Ignoring small changes allows the problem to grow unnoticed. The second silent health risk after 70 is declining respiratory efficiency. Breathing changes slowly with age. Lung elasticity decreases. Chest muscles weaken. Breathing becomes shallower without the person realizing it. This is especially dangerous during sleep. Oxygen levels may drop slightly but consistently. The brain adapts, so the person does not wake up. Doctors see this pattern often. People believe they are sleeping normally, yet their bodies are not receiving enough oxygen for full repair. Symptoms include morning headaches, daytime fatigue, memory issues, and reduced concentration. These are often blamed on age, not breathing. Over time, low oxygen levels stress the heart and brain. The risk of stroke, heart rhythm disturbances, and cognitive decline increases. This risk remains silent because breathing problems do not always feel dramatic. Paying attention to sleep quality, snoring, breathing pauses, and unexplained fatigue is critical after 70. The third silent health risk after 70 is muscle loss hidden behind normal activity. Many older adults believe they are maintaining strength because they can still perform daily tasks, but doctors explain that muscle loss can occur even when routines remain unchanged. This condition, known as age-related muscle decline, happens gradually. Strength decreases slowly. Balance becomes less stable. Reaction times lengthen. Because the change is subtle, people adjust without noticing. They move more cautiously, they avoid certain activities, they rely on support more often. By the time weakness becomes obvious, recovery is much harder. Muscle loss increases the risk of falls, fractures, and loss of independence. It also affects metabolism and immune function. Doctors emphasize that muscle is not just for movement. It protects organs, stabilizes blood sugar, and supports posture and breathing. Daily gentle resistance, walking, and movement awareness help preserve muscle. Doing nothing allows silent decline. The fourth silent health risk after 70 is dehydration. Older adults often drink less water, not because they don't need it, but because thirst signals weaken with age. Dehydration does not always cause obvious thirst. Instead, it causes dizziness, confusion, constipation, low blood pressure, and increased fall risk. Doctors frequently discover dehydration after hospital admissions for unrelated issues. Mild dehydration stresses the kidneys, thickens the blood, and increases the risk of clots. Because it develops quietly, many people live in a constant state of mild dehydration without realizing it. Regular fluid intake, not just when thirsty, is essential after 70. The fifth silent health risk after 70 is medication interaction. Many older adults take multiple prescriptions. Each may be necessary, but together they can interact in harmful ways. The aging body processes medications more slowly, drugs stay active longer, side effects intensify. Sleep medications may suppress breathing, blood pressure drugs may cause dizziness, pain relievers may affect kidney function. Doctors often see serious nighttime events linked to medication combinations that were never reviewed. Because medications were prescribed gradually over years, people assume they are safe indefinitely. Regular medication review is critical. What was safe at 60 may not be safe at 75. This risk remains silent because side effects build slowly. The sixth silent health risk after 70 is cognitive overload and mental fatigue. The brain becomes more sensitive to stress with age. Constant worry, noise, multitasking, and emotional strain exhausts the nervous system. Mental fatigue weakens memory, attention, and emotional regulation. It also affects sleep and immune health. Doctors note that chronic mental stress increases inflammation and accelerates cognitive decline. Many older adults underestimate the impact of mental overload, believing it to be just part of life. Creating calm routines, reducing unnecessary stress, and allowing the brain to rest are protective habits. The seventh silent health risk after 70 is social withdrawal. Loneliness does not always feel dramatic. It often feels quiet. People slowly reduce interactions. They speak less, they engage less, they withdraw without realizing it. Doctors have found that social isolation increases the risk of heart disease, depression, cognitive decline, and early mortality. Human connection stimulates the brain, regulates stress hormones, and supports immune function. This risk is silent because loneliness can exist even when people are surrounded by others. Daily meaningful interaction, even small, protects health more than many realize. The eighth silent health risk after 70 is ignoring sleep changes. Light sleep, frequent awakenings, and daytime fatigue are often accepted as normal aging, but doctors warn that these changes may signal deeper problems, including breathing disorders, heart rhythm instability, or neurological changes. Poor sleep affects every system in the body. Ignoring sleep quality allows multiple risks to grow together. Sleep deserves attention, not dismissal. The ninth silent health risk after 70 is reduced body awareness. Many older adults stop paying attention to posture, movement quality, and physical signals. They focus on completing tasks, not how the body performs them. Doctors emphasize that awareness protects safety. It prevents falls, it reduces injury, it maintains coordination. Slowing down and moving with intention reduces silent risk. The 10th silent health risk after 70 is believing it is too late to change. This belief is one of the most dangerous of all. Doctors consistently observe that positive changes benefit people at any age. Movement improves circulation, nutrition strengthens the immune system, sleep quality enhances brain function, social connection lifts mood. The body remains responsive far longer than most people think. The greatest risk is giving up quietly. These silent health risks do not mean danger is inevitable. They mean awareness is essential. Small adjustments can prevent large consequences. Listening to the body, respecting change, acting early. Longevity after 70 is not about fear, it is about attention. The body speaks softly. Those who listen live better. Thank you for listening, and we look forward to sharing more wisdom with you in the next video.